नमस्ते जी। मेरा नाम डॉक्टर भानु मिश्रा है। मैं नेफ्रोलॉजिस्ट और ट्रांसप्लांट फिजिशियन हूँ बीएल कपूर मैक्स हॉस्पिटल दिल्ली में। और आज हम यहाँ पे इस वीडियो को बनाने के लिए आए हैं एक इम्पॉर्टेंट टॉपिक को लेके, जिसे हम कहते हैं पीडल एडिमा एंड सीकेडी, कॉजेस, सिम्टम्स एंड ट्रीटमेंट। तो I warmly welcome you for this event, and today we are going to explore about pedal edema and how it is related to CKD. And before we move ahead, we should know what is pedal edema. So it is a condition where extra fluid accumulates in your lower legs, feet, your abdomen, your face, and this extra fluid is called the edema. If it is in your legs, it is called pedal edema. And our body fluid accumulates into two main cells. One is the outside of the cells, one is the inside of the cells. Now the outside of the cells is what you can see as pedal edema. This problem happens mainly because of three big problems in our body. One is could be related to kidney, could be related to liver, or it could be related to heart, and other issues like thyroid and so on. Kidneys, and being a nephrologist, I will try to focus more on kidneys, is a crucial role in playing in managing this pedal edema and regulating this body fluid balance. Now the kidney removes the extra waste, salt, water out of your body, and if they are not functioning well, either in the stage of AKI or in the case of CKD, or in the case of nephrotic syndrome, edema could come, and it is a major symptom of a CKD patient. Now we are going to talk about what is edema. Before we move ahead, everyone should know that what is edema. So there are two types of edema you have to understand. One is the generalized, one is the localized. So generalized meaning you have edema everywhere, like on face, chest, abdomen, hands and legs, which usually happens in nephrotic syndrome and in severe stages of volume overload. And it could be localized edema, could be because of one body part or because of inflammation. This localized edema usually is secondary to any cellulitis or local damage or part of the lymphatic fluid being blocked, as in the case of elephantiasis or now the edema, the other type that you have to understand is about the pitting and non-pitting edema. Pitting means if you press them, there will be a your finger will intend to go in. Now that pitting edema is classical for kidney problems and liver and heart problems as well. Now non-pitting edema comes in lymphatic acids, cellulitis, or in hypothyroid related edema, as we just discussed. Now, how do you manage this edema and what is the approach to manage this? Now, first you have to understand the non-pharmacological. Without medicines, what we can do in diet and in other management. So the first step that comes is about the limb elevation. So if you have lot of edema in your legs, you have to elevate your legs bilaterally. Compression therapies like compression stockings and can reduce edema. Physiotherapies can also help to do the same. And in cases of cellulitis and congested areas, even ice application sometimes can help. Now, as we talk about diet, fluid restriction and salt restriction are the most important thing. Salt restriction, you have to understand, you have to take less salt in your diet. Only 5 grams per day is allowed, which is like a small teaspoon taken in a flat quantity. So diuretics, the other is the pharmacological way of managing it. Now in diuretics, there are multiple classes of diuretics that we can discuss, but the most important is the loop diuretics in case of CKD and thiazides, as well as in potassium sparing diuretics. So in loop diuretics, they are preferred because they are very potent drugs, and they causes a lot of diuresis and edema decreases very fast. But in milder cases of CKD where GFRs are good, even thiazide diuretics and potassium sparing diuretics can also do wonders. The other important thing, when you use pharmacological treatment like diuretics and potassium sparing diuretics, these can cause electrolyte imbalance like sodium, potassium, and sometimes other electrolytes as well, magnesium. So when you do this, it is prudent to monitor them on regular basis and look for their side effects, like in case of hypokalemia and hyperkalemia, hyponatremia, or these side effects you have to see. Now in CKD cases, as we just discussed, salt and fluid restriction and diuretics play the main role. And apart, if you this is the initial therapy, but when we speak as a doctor to public at large, the awareness of these problems is very important. Now if you see, we see in OPD a lot of many patients come, and when we see them, they have leg swelling or they have abdominal swelling. They sometimes designate those swellings to other causes, and sometimes because they are standing for too long, or they ate something one day before. But you have to understand, because if you have leg swelling and you have face swelling or anasarca for that matter, you have to evaluate yourself to see whether any of your big organs, like we just discussed, heart, kidney and liver, are damaged, and proper physician has to be counseled. We should not ignore your symptoms. So patient education becomes very crucial in understanding the importance of pedal edema. So you have to understand that this is an initiative in which we want you to join us in recognizing the National Edema Awareness Day on September 25th. And thanks for watching.